ಇನ್ಫರ್ಟಿಲಿಟಿ ಇಸ್ ಅ ಗ್ಲೋಬಲ್ ಕನ್ಸರ್ನ್, ಬಟ್ ಭಾರತದಲ್ಲಿ ಕೂಡ ಇದರ ಕೇಸಸ್ ಹೆಚ್ಚಾಗ್ತಾ ಇದೆ. ಆ್ಯಕ್ಚುಲಿ ಸ್ಪೀಕಿಂಗ್, ನಮ್ಮ ಪ್ರೀವಿಯಸ್ ಎಪಿಸೋಡಲ್ಲೂ ನಾವು ಮಾತಾಡಿದ್ವಿ ದಟ್ ಇನ್ಫರ್ಟಿಲಿಟಿ ಅಂತ ಕರೀದಿರ ಇದನ್ನು ಲೋ ಫರ್ಟಿಲಿಟಿ ಅಂತ ಕರಿಬಹುದು ಅಂತ. ಬಟ್ ಸ್ಟಿಲ್ ಹೆಚ್ಚು ಪ್ರಚಲಿತದಲ್ಲಿ ಇರುವಂಥ ಹೆಸರು ಇನ್ಫರ್ಟಿಲಿಟಿ. ಸೊ ಭಾರತದಲ್ಲಿ ಅಂತ ತಗೊಂಡಾಗ ಇಟ್ ಎಫೆಕ್ಟ್ಸ್ ಆಲ್ಮೋಸ್ಟ್ 10-15% ಆಫ್ ಮ್ಯಾರಿಡ್ ಕಪಲ್, ಅಥವಾ ಅದಕ್ಕಿಂತ ಹೆಚ್ಚಿದ್ರೂ ಇರಬಹುದು. ಆ್ಯಂಡ್ ಆಲ್ಸೋ ಮೇಲ್ ಫ್ಯಾಕ್ಟರ್ ಅಂತ ತಗೊಂಡಾಗ, ಅಂದರೆ ಮೇಲ್ ಇನ್ಫರ್ಟಿಲಿಟಿ ಅಂತ ತಗೊಂಡಾಗ ಇದರ ಸಂಖ್ಯೆ ಕೂಡ ಹೆಚ್ಚಾಗ್ತಾನೆ ಇದೆ. ಬಿಕಾಸ್ ಒಂದು ಟೈಮ್ ಇತ್ತು ವೆರೆನ್ ಮಕ್ಕಳಾಗ್ತಿಲ್ಲ ಅಂದರೆ ಅದು ಹೆಣ್ಣಿನ ಸಮಸ್ಯೆ ಮಾತ್ರ ಅಂತ. ಬಟ್ ಓವರ್ ಎ ಪೀರಿಯಡ್ ಆಫ್ ಟೈಮ್ ಟೆಕ್ನಾಲಜಿಯ ಅಡ್ವಾನ್ಸ್ಮೆಂಟ್ಸ್ನ ಜೊತೆಗೆ ಸಿಮೆನ್ ಅನಾಲಿಸಿಸ್ ಬಹಳವಾಗಿ ಇಂಪ್ರೂವ್ ಆಗಿ ಇವತ್ತಿನ ದಿನ ಮೇಲ್ ಫ್ಯಾಕ್ಟರ್ ಇದೆಯಾ ಅನ್ನೋದನ್ನು ಕೂಡ ನಾವು ಫೈಂಡ್ ಔಟ್ ಮಾಡಬಹುದು. ಆ್ಯಂಡ್ ಈ ಥರದ ಕೇಸಸಲ್ಲಿ, ಇನ್ಫರ್ಟಿಲಿಟಿ ಕೇಸಸಲ್ಲಿ 40-50% ಅಷ್ಟು ಚಾನ್ಸಸ್ ಇರುತ್ತೆ ಆ ಕಪಲಲ್ಲಿ ಮೇಲ್ ಇನ್ಫರ್ಟಿಲಿಟಿ ಇರುವಂಥದ್ದು. ಸೊ ಇವತ್ತು ಇದ್ರ ಬಗ್ಗೆನೇ ಮಾತಾಡೋಣ. ಸೊ ವಿತ್ ಮೀ ಡಾಕ್ಟರ್ ಸುಪ್ರೀತ್ ಇದ್ದಾರೆ, ಹೂಸ್ ಅ ಕನ್ಸಲ್ಟೆಂಟ್ ಯೂರಾಲಜಿಸ್ಟ್, ಪದ್ಮಶ್ರೀ ಡಯಾಗ್ನೋಸ್ಟಿಕ್ಸ್ನ ಜೊತೆಗೆ ಅಸೋಸಿಯೇಟ್ ಆಗಿದ್ದಾರೆ ಕಳೆದ 1 ವರ್ಷದಿಂದ. ಆ್ಯಂಡ್ ಡಾಕ್ಟರ್, ಇದು ನಿಮ್ಮ 4th year ಆಫ್ ಪ್ರಾಕ್ಟಿಸ್. ಡು ಯು ಥಿಂಕ್ ಮೇಲ್ ಇನ್ಫರ್ಟಿಲಿಟಿ ರೇಟ್ಸ್ ಕೂಡ ಹೆಚ್ಚಾಗ್ತಾ ಇದೆ ಅಂತ ಭಾರತದಲ್ಲಿ, ಸ್ಪೆಸಿಫಿಕಲಿ ಬೆಂಗಳೂರಲ್ಲಿ?
Of course, ma'am, because as you know, the population in Bangalore per se is ever increasing because of the migration and all those factors. And the thing is, it's more about more people are getting diagnosed rather than it's increased. It's people are more aware lately, and they are coming to the hospitals, because I see a lot of patients lately who even before conception, ಅಂದ್ರೆ ಅವರಿಗೆ ಮದುವೆ ಆಗಿ ಇನ್ನೂ 1 ವರ್ಷನೂ ಆಗಿರೋದಿಲ್ಲ, ಅಂಥವ್ರು ಮುಂಚೆನೇ ಬಂದು ನಾವು ಮಗು ಮಾಡ್ಕೊಳ್ಳೋ ಪ್ಲಾನ್ ಇದೆ, ಅದಕ್ಕಿಂತ ಮುಂಚೆನೇ ಒಂದು ಜನರಲ್ ಚೆಕಪ್ ಮಾಡಿಸಿ ಎವ್ಯಾಲ್ಯೂಯೇಟ್ ಮಾಡಿಸ್ಬೇಕು ಅಂತ ಇದೀವಿ ಅಂತ ಆ ಥರ ಅವೇರ್ನೆಸ್ ಬಂದಿದೆ ಈಗ. ಸೊ ಪ್ರಾಬ್ಲಿ ದಟ್ ಇಸ್ ವೈ ವಿ ಆರ್ ಸೀಯಿಂಗ್ ದ ಇನ್ಕ್ರೀಸ್ ಇನ್ ಇನ್ಫರ್ಟಿಲಿಟಿ ರೇಟ್ಸ್ ಆರ್ ವಾಟ್ ಯು ಆರ್ ಮೆನ್ಷನಿಂಗ್.
ಓಕೆ, ಸೊ ಸ್ಟಾರ್ಟಿಂಗ್ ಅಲ್ಲೇ ಹೇಳಿದ ಹಾಗೆ ಅದನ್ನ ಲೋ ಫರ್ಟಿಲಿಟಿ ಅನ್ಬಹುದಾ ದ್ಯಾನ್ ಇನ್ಫರ್ಟಿಲಿಟಿ? ಯಾಕಂದ್ರೆ ಐ ಥಿಂಕ್ ಸಿವಿಯರ್ ಊಸೋಸ್ಪರ್ಮಿಯಾ ಇರೋರ್ಗು ದೇರ್ ಆರ್ ಚಾನ್ಸಸ್ ಆಫ್ ದೆಮ್ ಕನ್ಸೀವಿಂಗ್, ರೈಟ್?
Correct, exactly. So there is it's a continuum, andre it is not like a black or a white. It means there is a continuum, andre one level alli one high normal irutte, one it comes back to a state of complete absence of. In that also we have options of retrieving sperms, andre ನಾವು ಕೆಲವು ಸಲ ಟೆಸ್ಟಸ್ ಇಂದ ಸ್ಪರ್ಮ್ಸ್ ತೆಗೆದು we can still have a clinical pregnancy.
And doctor, when should men consider testing ಅಂತ? ಯಾವಾಗ ಟೆಸ್ಟ್ ಮಾಡಿಸಬೇಕು?
Yes, so ideally if you ask me per se, for any married couple it is not actually necessary to test for everyone. So those who are planning for pregnancy, and they should actually try for a pregnancy without using a contraceptive for 1 whole year.
Okay.
So after 1 whole year of trying to conceive and still not able to conceive, then they should consult a doctor to evaluate for infertility or whatever things, even if it's for a male or a female.
Okay. And with age, ಬರೀ ಹೆಣ್ಮಕ್ಳು ಮಾತ್ರ ಅಲ್ಲದೆ ಗಂಡಸರನ್ನು ಇದು ಎಫೆಕ್ಟ್ ಮಾಡುತ್ತೆ. ಸೇಯಿಂಗ್ ಸ್ಪರ್ಮ್ ಕ್ವಾಲಿಟಿ ಡಿಕ್ಲೈನ್ ಆಗುತ್ತೆ. ಯಾವ ವಯಸ್ಸಿನ ನಂತರ ರ್ಯಾಪಿಡ್ಲಿ ಡಿಕ್ಲೈನ್ ಆಗುತ್ತೆ ಸ್ಪರ್ಮ್ ಕ್ವಾಲಿಟಿ?
There is no clear cut evidence rapid ಆಗಿ ಡಿಕ್ರೀಸ್ ಆಗುತ್ತೆ ಅಂತ, but it's after the age of 30 to 40. ಹೆಂಗೆ females ಗೆ there is something called as a menopause. Even for males there is something called as an andropause, means there is a certain hormones in the body called testosterone, which gradually decreases as you age, and ವಯಸ್ಸಾಗ್ತಿದ್ದಂಗೆ ಕಮ್ಮಿ ಆಗ್ತಾ ಇರುತ್ತೆ. And meanwhile the interest to perform ಅಥವಾ ಮತ್ತೆ ಅವ್ರ sperm quality ಕೂಡ over a time it gradually decreases. Just like how females ಅಲ್ಲಿ ಲೇಟ್ ಆಗಿ ಮದುವೆ ಆಗಿ ಲೇಟ್ ಆಗಿ ಮಗು ಮಾಡ್ಕೊಂಡ್ರೆ ಜೆನೆಟಿಕ್ ಅಬ್ನಾರ್ಮಲಿಟೀಸ್ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ ಮಕ್ಕಳಲ್ಲಿ ಅಂತ, ಮೇಲ್ಸ್ ಅಲ್ಲೂ ಕೂಡ ಆ ಫ್ಯಾಕ್ಟರ್ ಇದೆ, ಬಟ್ ಇಟ್ ಇಸ್ ಲಾಂಗ್ ಬೀನ್ ಅವಾಯ್ಡೆಡ್ ಆರ್ ignored and properly not evaluated still, but it is definitely a factor to consider.
And ಇವಾಗೆಲ್ಲ ಮದುವೆ ಆಗಿ ಒಂದು ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಲೇಟ್ ಮ್ಯಾರೇಜಸ್ ಅಂಡ್ ಅದಾದ್ಮೇಲೆ ಲೇಟ್ ಆಗಿ ಕನ್ಸೀವ್ ಆಗ್ತಾ ಇರೋದ್ರಿಂದ ಕೂಡ ಈ ಫರ್ಟಿಲಿಟಿ ಅನ್ನೋದು ಎಫೆಕ್ಟ್ ಆಗ್ತಿದೆ ಅನ್ಬಹುದಾ ಇನ್ ಮೆನ್ ಆಲ್ಸೋ?
Definitely, ma'am. That's what I was trying to convey. The sperm quality and even the drive to perform would reduce as you get older. So that is an important factor, and it will lead to infertility and also genetic problems in children.
But doctor, ಈ ತರದೊಂದು ಪಾಸಿಬಿಲಿಟಿ ಇದೆಯಾ ಅಂತ ನಮಗೆ ಹೇಳಿ. ಸಿಮನ್ ಇರುತ್ತೆ ಬಟ್ ಅದ್ರಲ್ಲಿ ಸ್ಪರ್ಮ್ ಇರಲ್ಲ.
Yes, there is a condition. It's called as azoospermia. Azoospermia ಅಲ್ಲಿ ಏನಿರುತ್ತೆ ಅಂದ್ರೆ basically ಅವ್ರಿಗೆ there will be semen coming out, but there will be absolutely no sperm in it. Okay, so this will happen usually. There is 2 varieties why this can happen. There is a block in the passage, or there might be the problem with production of the sperm at all. So even in these patients we are able to retrieve and still have a pregnancy with surgical support and some medical support. That's called as assisted reproductive technique, which we call.
Okay. And the male infertility cases alli almost ಒಂದು 50% of the cases ಗೆ contribute ಮಾಡ್ತಿರೋದು genetics.
Yes, ma'am. So genetics does play an important role. Many a times it is always ignored. Kutagala, nobody checks and evaluates it, and sometimes it carries from generation to generation, or sometimes it might just start from that generation. So that's called as a sporadic variety. So E varieties, since they are not able to conceive, they come to the doctor, they get evaluated for this. Then we evaluate for genetic sicknesses. So ಕೆಲವರಲ್ಲಿ genetics ಅಲ್ಲಿ problems ಇದ್ರೆ ಕೆಲವರಲ್ಲಿ we will advise not to continue the pregnancy. ಕೆಲವರಲ್ಲಿ it is okay to continue. So that decision to make to continue or not continue is needed when there is a history of family lo ಏನಾರು ಈ ತರ ಇದ್ರೆ better to evaluate that.
ಓಕೆ ಸೊ ಸಿಮೆನ್ ಅನಾಲಿಸಿಸ್ ಅಂತ ಮಾಡಿಸಿದಾಗ ಸಾಕಷ್ಟು ಪ್ಯಾರಾಮೀಟರ್ಸ್ಗಳ ಅನಲೈಸೇಷನ್ ಆಗುತ್ತೆ ಅಂಡ್ ಗೊತ್ತಾಗುತ್ತೆ ವಾಲ್ಯೂಮ್ ಎಷ್ಟಿದೆ, ಮೊಟಿಲಿಟಿ ಹೇಗಿದೆ, ಮಾರ್ಫಾಲಜಿ ಹೇಗಿದೆ ಅಂತೆಲ್ಲ ಗೊತ್ತಾಗುತ್ತೆ. ಬಟ್ ದೆನ್ ಜಸ್ಟ್ ಇನ್ ಕೇಸ್ ಅದು ಎಫೆಕ್ಟ್ ಆಗಿದೆ ಆಲ್ರೆಡಿ ಅನ್ನೋದಿದ್ರೆ ಲೈಫ್ ಸ್ಟೈಲ್ ಕರೆಕ್ಷನ್ಸ್ ಮಾಡ್ಕೊಳ್ಳೋದ್ರ ಮೂಲಕ ಈ ಪ್ಯಾರಾಮೀಟರ್ಸ್ನ ಸರಿ ಮಾಡ್ಕೋಬಹುದಾ?
Yes, definitely, ma'am. See, the three important things what we look for in a semen analysis is first to the count should be appropriate, and it should have a good motility, and it should have a proper shape. Okay, these are three important things which the fertility potential of a male would depend. So as you told me, lifestyle factors will be affected in the motility aspect ಮತ್ತು the morphology and the shape of the sperm relatedly. This will usually get altered when there is lifestyle factors, meaning there might be smoking, there might be alcohol, there may be sedentary lifestyle leading to obesity and all that factors that will definitely lead to infertility. So lifestyle factors along with the pollution which we encounter every day in a day-to-day life will definitely affect. One of the most important things, having a healthy lifestyle, eating a balanced diet, having a regular exercise, avoid smoking and alcohol, of course, and few things which is recently being coming up is something called about microplastics. Microplastics are andre now we tend to eat hot stuff in any plastic containers and plastic. So there's a lot of things which is released from the plastic that is not good for the body, meaning that will also affect the infertility aspect of it. So it is a thing to concern. So avoid using plastics, especially in hot beverages and hot foods.
ಓಕೆ ಸರ್, ಇವತ್ತಿನ ದಿನ ಅಸಿಸ್ಟೆಡ್ ರಿಪ್ರೊಡಕ್ಟಿವ್ ಟೆಕ್ನಿಕ್ ತುಂಬ ಚಾಲ್ತಿಯಲ್ಲಿದೆ ಆ್ಯಂಡ್ ಐ ಥಿಂಕ್ ಇಟ್ಸ್ ಲೈಕ್ ಅ ಬ್ಲೆಸ್ಸಿಂಗ್ ಫಾರ್ ಲಾಟ್ ಆಫ್ ದೆಮ್. ಈ ಥರ ಇಶ್ಯೂಸ್ ಇರೋಂಥವ್ರಿಗೆ ಎಷ್ಟು ಮಟ್ಟಿಗೆ ಇದು ಹೆಲ್ಪ್ ಆಗುತ್ತೆ ಅಂತ ಅನ್ಸುತ್ತೆ?
See, assisted reproductive techniques ಅಂದ್ರೆ basically sometimes when they are not able to do on a natural basis, we use certain medications to assist the reproduction or certain surgical methods to assist the reproduction. So we always divide if it is a male factor infertility, mild, moderate, severe. So severe versions ali there are varieties so that about 10 to 30% chances that they can still have a pregnancy in a severe variety. But mild chances, the chances are 80 to 90%. Okay, the chances are good, meaning male factor mild agirutte, female factor mild agidre the chances are pretty more. But eventually the thing is there are stages of assisted reproduction techniques. Assisted reproductive techniques ali we usually support the pregnancy either medically or surgically. Okay, so in this method what we do, there is a continuum and there are more varieties of assisted reproductive techniques commonly is employed in any of the fertility centers. If you can see, one is something called as an IUI, that is intrauterine insemination. That is the most basic form of all. This is used in mild male infertility factors and mild problems irtave, andre count ಸ್ವಲ್ಪ ಕಮ್ಮಿ ಇರ್ತವೆ ಅಥವಾ ಮಾರ್ಫಾಲಜಿ ಮೈಲ್ಡ್ ವೇರಿಯೇಷನ್ಸ್ ಇರುತ್ತೆ, ಇಲ್ಲ ಸ್ಪರ್ಮ್ದು ಮೊಟಿಲಿಟಿ ಸ್ವಲ್ಪ ಇಶ್ಯೂಸ್ ಇರುತ್ತೆ. ಅಂಥವ್ರ ಮೈಲ್ಡ್ ಇಶ್ಯೂಸ್ ಇದ್ದರೆ IUI ವಿಲ್ ವರ್ಕ್ ಆ್ಯಂಡ್ ದ ಚಾನ್ಸಸ್ ಆಫ್ ಸಿಗ್ನಿಫಿಕೆಂಟ್ ಪ್ರೆಗ್ನೆನ್ಸೀಸ್ ಅರೌಂಡ್ 30 to 40% with a single sitting. But if you want a better chances, if there is moderate problems idre, we will go for IVF, that is in vitro fertilization, where we pick the sperm, we pick the egg and grow it in a laboratory setting and slowly implant it. That is called as IVF. Another variety where, as I mentioned to you about azoospermia, where the counts are really low, we have to find the sperm, single sperm, and then use it. There we use a technique called as ICSI, meaning intracytoplasmic injections, where inject each sperm into the egg directly. So that in that modality, the chances of pregnancy even more compared to the first variety. So definitely there is chances for mild to moderate varieties, but people who are having recurrent failures and all, we have to reevaluate the genetic causes.
ಓಕೆ ಸರ್, ಇವಾಗ ಹೆಣ್ಮಕ್ಳು ತಾಯಿ ಗರ್ಭದಲ್ಲಿರುವಾಗಲೇ ಡಿಟರ್ಮಿನ್ ಆಗಿರುತ್ತೆ ಅಂತ ಹೇಳ್ತಾರೆ ಎಷ್ಟು ಎಗ್ಸ್ ಆಕೆಯಲ್ಲಿರುತ್ತೆ ಫಾರ್ ಹರ್ ಲೈಫ್ ಟೈಮ್ ಅಂತ. ಅದೇ ಥರ ಡು ಯು ಥಿಂಕ್ ಇಟ್ ಹೋಲ್ಡ್ಸ್ ಗುಡ್ ಫಾರ್ ಅ ಮ್ಯಾನ್ ಆಲ್ಸೋ?
Usually not, because over a period of time, as in after puberty sets in and slowly as they grow up, the follicles and the where the sperm is being produced alva aa jaga will keep developing, and every time it has a cycle of 3 months and it will replenish every time. but the stores will of course reduce as we get older.
ಓಕೆ ಓಕೆ ಆ್ಯಂಡ್ ಇವಾಗ ಒಂದಷ್ಟು ಸ್ಟೇಟ್ಮೆಂಟ್ಸ್ ಡಾಕ್ಟರ್ ಇದು ಮಿಥ್ತಾ ಫ್ಯಾಕ್ಟಾ ನಮ್ಗೆ ಹೇಳಬಹುದಾ? ಅ ಮ್ಯಾನ್ ಕ್ಯಾನ್ ಹ್ಯಾವ್ ಅ ಸ್ಟ್ರಾಂಗ್ ಸೆಕ್ಸ್ ಡ್ರೈವ್ ಆ್ಯಂಡ್ ಸ್ಟಿಲ್ ಬಿ ಇನ್ಫರ್ಟೈಲ್ ಅಥವಾ ಹ್ಯಾವ್ ಲೋ ಫರ್ಟಿಲಿಟಿ?
Of course, ma'am, because sex drive, meaning the ability to perform and the interest to perform, is totally different than having a clinically significant baby hago anta chances irodukku. It's completely different because there are different hormones handling each other. So we see a lot of patients having completely normal sexual life, but they're not able to conceive.
Okay.
It's quite common.
Okay. A low sperm count means no chance of having a baby.
This is actually a myth because I told you, even with zero sperm count which we found, we are able to retrieve sperms and still have pregnancy. So that this is definitely a myth.
Yes. Cycling or using a laptop can destroy sperms.
No, this is a myth again. So it is good to have physical activity, so it will improve on a wholesome level, meaning on a mental level and a physical level, and even on your sexual health. So it is a myth. And of course there are a few new research topics about where you keep your phone in your pockets, the radiations about it, and the temperature which it causes can affect your motility, and it's still in a dilemma range. But of course it's better to keep it away.
Okay. Stress has no impact on male fertility.
It's again a myth. It definitely impacts stress because stress itself is a important factor. It will affect your emotional health. Emotional health will in turn creates less sex drive for people to have. So that itself is one of the reasons where we see a majority of the patients where it's difficult for them to perform. So in that issues, if you deal that part of it, again the fertility chances are better.
Okay. ಡಾಕ್ಟರ್, ಸಾಕಷ್ಟು ಡಿಸ್ಕಸ್ ಮಾಡಿದ್ವಿ ಅಬೌಟ್ ಫರ್ಟಿಲಿಟಿ ಆ್ಯಂಡ್ ಎಸ್ಪೆಷಲಿ ಮೇಲ್ ಫರ್ಟಿಲಿಟಿ. ಡು ಯು ಥಿಂಕ್ ಇನ್ಯಾವುದಾದ್ರು ಪಾಯಿಂಟ್ಸ್ನ ನಾವು ಅಡ್ರೆಸ್ ಮಾಡಬೇಕು ಅಂತ ನಮ್ಮ ಗಮನಕ್ಕೆ ಬರ್ದೇ ಇರೋದು? ಬಿಕಾಸ್ ಡೇ ಇನ್ ಆ್ಯಂಡ್ ಡೇ ಔಟ್ ನೀವು ನೋಡ್ತಾ ಇರ್ತೀರಾ ಪೇಷಂಟ್ಸ್ನ, ವಿಚ್ ಇಸ್ ದಟ್ ಒನ್ ಮೋಸ್ಟ್ ಕಾಮನ್ ಇಶ್ಯೂ ದಟ್ ಪೀಪಲ್ ಕಮ್ ವಿತ್?
See, in my clinical practice, every day when I see, a majority of the people counts are relatively good. The issue here is the motility and the morphology and the shape of the sperm.
Okay.
So in this, when we evaluate, we find out that there is some condition called as varicocele. Varicocele, and these are just certain veins which are above the testis, which will alter the temperature of the whole testis. So that will affect the sperm's health. Okay. So this is commonly encountered, which is on a day-to-day OPD practice. Otherwise, then most common would be sexually transmitted infections or a urinary tract infections. That will also affect the sperm count and all. These are very correctable causes. If you treat the infection, you can get your counts back and your morphology back. All that will be reverted back to normal. So these are treatable causes again. And few other things are, some people will be taking steroids when they're performing in the gym. That would again affect your fertility because that is you're giving testosterone from the outside. That will affect the testosterone which is produced in the inside.
Okay.
So that will again affect the fertility.
Okay.
So on the basis how we are going to evaluate this is, first and the foremost, yaara nam patient nam hatra bandre they're trying for a year, they're not able to conceive and have a baby. So we first and foremost, for a male, we evaluate with a semen analysis. So semen analysis, as I told you, 3 important parameters we check. If there is any issues in the parameters, we ask a few blood tests to check for the hormone levels. Those are hormones from from the brain which controls the secretion of testosterone and the production of the sperm. ಈ ಹಾರ್ಮೋನ್ಸ್ನ ಎವ್ಯಾಲ್ಯೂಯೇಟ್ ಮಾಡಿ ಕೆಲವು ಸಲ ನೆಕ್ಸ್ಟ್ ಸ್ಟೆಪ್ಪಲ್ಲಿ ಅಲ್ಟ್ರಾಸೌಂಡ್ ಮಾಡ್ತೇವೆ ನಿಮ್ಮದು ಸ್ಕ್ರಾಟಮ್ ಏರಿಯಾದು. ಬೇಸಿಕಲಿ ಟೆಸ್ಟಿಕಲಲ್ಲಿ ಮೇಲೆ ವ್ಯಾರಿಕೋಸೀಲ್ ಇದೆಯಾ, ಟೆಸ್ಟಿಕ್ಯುಲರ್ ಸೈಜ್ ಸರಿ ಇದೆಯಾ, ದಿಸ್ ಆರ್ ದ ಫ್ಯೂ ಬೇಸಿಕ್ ಟೆಸ್ಟ್ ವಿಚ್ ವಿ ಡು.
ಓಕೆ. ಆ್ಯಂಡ್ ಮತ್ತೊಂದು ಎಪಿಸೋಡ್ ಮಾಡೋಣ ವೆರಿನ್ ವಿ ಟಾಕ್ ಅಬೌಟ್ ಸಮ್ ಕಾಮನ್ ಯೂರೋಲಾಜಿಕಲ್ ಇಶ್ಯೂಸ್ ಇನ್ ಮೆನ್. ಬಟ್ ಫಾರ್ ದಿಸ್ ಎಪಿಸೋಡ್ ತುಂಬ ಇನ್ಸೈಟ್ಫುಲ್ ಆಗಿತ್ತು ನೀವು ಕೊಟ್ಟಂಥ ವಿಷಯಗಳು. ಥ್ಯಾಂಕ್ ಯು ಡಾಕ್ಟರ್.
ಥ್ಯಾಂಕ್ ಯು ಸೊ ಮಚ್ ಮ್ಯಾಮ್.